You're listening to 419 Education and Training Need to Connect podcast. Hello, everyone, and welcome to another episode of Need to Connect podcast. I am your host, Davonna Willis, the founder and CEO of the Black Massage Therapist Conference. And today we have Miss Ericka Clinton. Say hi, Ericka.
Hi, everyone.
And so we're going to be talking about oncology massage and why she decided to choose that as one of her specialties. But before we get started with that, please like, share, and subscribe to this channel, as well as register for the conference. Buy one of your t-shirts that says I am Black History and Black Massage Therapist on the back. I don't have that one on today, but I usually have that one on as well. So support, we're looking forward for you guys to join us. So now let's get into the business. So, all right, Ericka. So before we get into the oncology, just tell us your background and also how do we get to know each other, the years of relationship.
Okay, I promise I won't tell any embarrassing stories. But I've been a massage therapist now for 27 years. Mm-hmm. And I am based in New York City.
Yes.
And I have worked at the Swedish Institute, which is the school where I got my training 27 years ago. I've been teaching there for 25 years. And from 2016 to 2024, I was actually the dean of the program.
Nice.
So it is through that auspicious organization that I had the wonderful opportunity to meet you.
Yes.
When you attended the Swedish Institute as a student. And I remember when I first met you, I was just highly impressed.
Oh, thank you.
Because you were an athletic trainer. And I was like, what are you doing here with us? And you were like, no, these are the skills that I need to make the work that I do with my athletes top notch. And I had so much respect for you to come back to school and to do the training with us as massage therapists. And I was always kind of trying to tell all the other women of color, like, look over there.
Right.
See what's possible when you really apply yourself and put yourself really thinking about a goal and a dream for yourself.
Absolutely.
You know, that might start by being a massage therapist. I won't say just, but that it can take you to so many other places.
Exactly. Thank you. I appreciate that. And I was like, oh my goodness, we have someone here that is in the administrative role, because as we know, it's very hard for women of color and just Black people in general to get certain roles, right? And, you know, coming from New York City, New York is diverse. So, but still to see someone in that role, because for me, I didn't really know any other Black massage therapists, especially when I started school, right? We had a white massage therapist that came into the school to work on our athletes. And then what you see on TV with, you know, people getting a massage, and you never see us.
Yeah, we're not part of those ideals, those dreams, or those aspirations for whatever reason. And when I went to school, I think I was like 1 out of 5 in my whole class, you know, and this is when we had big classes. So we had, 70 students in one time schedule. So in my nighttime schedule, there were 50 to 70 of us. And I was 1 of 5 people, and that was so much of the standard. So it was, for me, it was amazing when I got the opportunity to run the program. And I was like, this is it. Right. Like this is that place that I never thought I would get to or dreamed about.
Right.
But wasn't sure if I was going to be able to advance.
Exactly.
And that's one thing that I can say about having a really good employer is that They had a lot of other people to choose from,
Okay.
but they chose me.
Amen.
And they were like, you are the best person for this job. And I was like, okay. And of course, I realized why. I had always been the person who was like, what do you need? I'll do it.
Right.
I mean, but that's the other part about this conversation, right? Is that when we're in situations, we always have to work 50 to 100% harder than everybody else.
Yes, unfortunately, that is the case.
And so I remember when other people would say, I'm not really comfortable doing that. And they were saying this to the current dean or my boss. And I would be like, I got it. I'll help you. I'm happy to be uncomfortable when we have work that we need to do. And of course, I knew I could learn something from her.
Right.
So when she decided to retire, she was like, I think you're the only person who can actually do this job. I felt completely honored that she trusted me and wanted to promote me.
But let's talk about that, right? Being in uncomfortable spaces always lead to growth, right?
Absolutely.
And a lot of people usually feel very safe in their 12 by 12 room or in their car going to one of their clients' houses. But to go to the next level, you got to be a little bit uncomfortable.
Yes. And I think, I've always been amazed when massage therapists kind of talk about how they've burnt out or how the work isn't stimulating to them anymore. Because even being in school, the one thing I realized about massage therapy was I was never going to be obsolete.
Right.
I could always reinvent myself in a work that had like over 1,000 modalities that we could perform.
Exactly.
And so therefore I could always make it interesting and grow. And so I don't know if it was the program I was trained in or just the people that I came from, but the fact that it was like, yeah, it's going to be uncomfortable. It's going to be scary. It's going to be hard because it's new. But the opportunity to always kind of jump into spaces that other people were like, no, I can't go into that space, has allowed me great opportunity. I mean, I got to work at the #1 cancer hospital in the country.
Talk about
it. Because I was willing to walk into, an opportunity that I was given at Sloan Kettering and be part of their integrative medicine team when I had no formal education in oncology massage. But what I had was a reputation in the business as the person who was never going to turn away a client from getting massage. When other people were like, no, that's contraindicated, that's too complicated.
Right.
I don't understand how to do this. I was like, my business is going to be formulated with the understanding that everybody deserves touch.
Amen.
And no matter what your condition, if you can get to my office or you can get me to come to your home, I'm going to figure out how to work with you safely and effectively,
right,
to the best of my ability, to try and support you with therapeutic touch, which we've all seen has so many great opportunities for wellness and healing and just connection to the body. And so when people didn't want to work on other people, they said, oh, but you can call my colleague Ericka and she will work on you or she will figure it out. And that kind of, some people might call it brazenness, but just belief in the fact that it was possible allowed me to get a job at Sloan Kettering, for them to be, to say, you have no formal education, but we know you have done it all and worked effectively with people. And our other therapists recommended you to join the team.
That's
and
nice.
Yeah. And there I was.
How did that, because Sloan Kettering is a big cancer hospital in New York City. How did that happen? Like, what was there a post, or like, tell us about how that came about?
So it's one of those horrible massage therapist stories, but basically my business fell apart.
Okay.
Like, that's why when I go to the Black Massage Therapist Conference, I go to your class specifically.
Yes.
Because it's a business class and I sit there and I'm like, oh my God, everything she's saying I can actually do.
Right.
Because business was the thing that I was like, I can do everything else, but I'm not a good business person. And so
and by the way, I'm teaching that same class this year for those who didn't make it last year because they was in another class. I think it's so important. Thank you for that. Business retention strategies and marketing strategies is very important. But go ahead.
As a sidebar, I did exactly what you said. I figured out who my client was.
Okay.
And when I did that analysis, really thinking about all the things you taught us in that class, one, I was shocked at who my client was. But when I looked at my patients, I was like, those are the regulars.
See?
Those are exactly who she told me to think about. And now I approach the work differently. And literally, I'm overwhelmed with business, which is never a bad thing.
All right, I'm gonna tell my assistant, cut this little part snippet for the business retention class.
Right. And it's like, I haven't even done 50% of the stuff you told us to do. Mm-hmm. I just did this one piece.
Yes.
And it is changing so much about my business. So now I have to go back and be like, okay, let me get the rest of it.
What's the rest of it?
So I can put it in practice. Well, it's actually taking some of those steps to really engage in marketing and things that are still really not my strength.
Right.
But I know will allow me to build a brand, which I feel like is really important for me to do because I love what I do, but I need to bring other people in to help me do this work.
And that's okay. Then I just say, I have a VA. You can't do all of this by yourself. It's no way. You think I'm going to sit here and edit this video? Absolutely not. Right? Hello. Thanks for watching. Please like, subscribe, and share our 419 Education and Training Need to Connect podcast.
So it's important to do that. But so my business in 2010 fell apart.
Okay.
I don't know where all the clients went, but poof, Ericka had no clients.
Really?
And I was trying to figure out what my next step was. I was teaching at the Swedish Institute, and one of my colleagues, lovely man, his name's Cody Landis, he said, I work at these two places, and I think you would fit in really amazingly. So one of them was literally a drug treatment program specifically for people who were HIV positive.
Oh, okay.
And they had massage available. And Cody was like, I think you would work really great there. And I'm also working at Sloan Kettering. And he was transitioning by going to nursing school.
Okay.
And he was like, we're going to need new people on the team. And I think you would fit great into the integrative medicine department. And so literally within probably 6 months, I had both jobs at these two different places.
Oh, wow.
And at Sloan Kettering, what was amazing is when I started working in the outpatient center, within a few months, my boss said, you know, we have a few members of our team who go into the hospital. And a lot of the people who were going into the hospital were unfortunately burning out.
Okay.
Because it's hard to work in oncology.
Yes.
And what I also always tell my students when they study with me is like, as wonderful as this work is, doing it every day is really hard.
Yes.
Like sometimes you just need a 60-minute Swedish on your calendar. Right. Mm-hmm. And so she said to me, you know, a lot of people want to come out of the hospital. I need somebody to step in. Would you like to have a day shift in the hospital? And I had never done hospital-based work. No, that's wrong. I had worked at Columbia Presbyterian for a little bit.
Okay.
Under Dr. Mehmet Oz when he was Oprah's favorite doctor.
Yeah.
Because he was head of cardiac and thoracic surgery, the assistant chief in cardiac and thoracic surgery when I worked there. And he was a big proponent of getting people a massage. I mean, you just had a quadruple bypass, but yeah, you should have a massage. And I was like, okay.
That's crazy.
It's crazy. So I started also then working in the hospital at Sloan Kettering as part of my work on the interdisciplinary team. And so I got a lot of experience again, just because I had a reputation as someone who wasn't going to be risky, but was really going to try and make touch therapy accessible to as many people as possible. Mm-hmm. And it didn't matter how sick or how compromised. I remember one person. This happened at Columbia Presbyterian. They asked me to see somebody in the cardiac ICU. And when people are in cardiac ICU, they're pretty sick. And I remember I went into the unit, and the patient that I was supposed to see was completely anesthetized. And he was in this like cocoon sleeping bag device that they had to put him in because his kidneys were failing and he needed to retain body heat. And the compression was also helping him with fluid moving through his body because his kidneys weren't working.
Wow.
And the only thing that was sticking out were his feet. I remember the doctor was like, "Can you help him?" And I was like, oh, okay, we'll do something. I mean, I've only got access to his feet, but sure. And you know what? Thank goodness we study Eastern medicine in New York.
That's true.
Because I had access to 5 kidney points on the kidney channels. And I worked that for about half an hour. And I left, you know, his wife was like, "Thank you for coming." And I was like, I don't know what I just did.
Right.
Thank you. Thank you for having me. The next day, Davonna, I come into the hospital. They're like, "Get back up to the cardiac ICU. They need," and I was like, "What are you talking about?" I get there. They're like, "Okay, whatever you did, you're going to do it again because his kidney function improved by like 30%.
Oh my
yesterday."
gosh.
And I was like, yes, it did.
Okay.
Yes, it did.
30%, Ericka?
Yes. I mean, to the point where they were like, if he keeps moving in this direction, we're going to send him to a long-term rehab because he doesn't need to be in the cardiac ICU anymore if his kidneys were functioning. And I thought, 5 points on a kidney meridian.
I did like shiatsu. I don't remember it now, but I loved it when we practiced, when we were working on it.
Yeah, I mean, it gives you so much. It gives you so many other things that you can do, which is nice.
For sure. I love that. So let's talk about oncology. So when Ericka came, let me go back. So Ericka came to the last 2 conferences. So she came the first year. It was so great to see her because it was a long time. And we just gave each other a big hug and we talked. And then she came last year. So one, I'm going to ask you, what was your experience first year versus second year? And then I'm going to bring it back to the oncology. So let's talk about that. Okay.
Well, the first year was so amazing. And I was just so proud of you. I was like, look, this is Davonna. She went to Swedish Institute. And I thought, this is really amazingly brave, first of all, to put this on. And I was also shocked because I've done conferences before. And I was like, this is a really good showing of people in terms of numbers, great support from vendors and sponsors.
Right.
And just a real amazing engagement from the community. I mean, it was literally something that you felt in those classrooms.
Right.
And in the spaces when we were all together, kind of looking around and being part of something that like had never happened before.
Right. We made history in 23.
Right. We did. It was just kind of like, it just was amazing. And I just was so overjoyed to be part of that and so proud that this was happening. And this was something that had changed for me because when I became a massage therapist, how do I put this? I had come out of an environment, I'd gone to prep school. So I came out of an environment that was very supposedly democratic, but also very segregated, unfortunately. Right. And we were always the Black kids who went to prep school. Right. And so as a massage therapist, I was always kind of, I guess, happy that when we segregated ourselves or divided ourselves, it was by modality, not by race. Right? Like these are the myofascial people, these are the prenatal people, these are the Asian bodywork people.
Right.
But after doing it for 25 years, the reality of the fact that we represented such a small population as far as clients and therapists almost became a little overwhelming. And then obviously all of the stuff that was happening in our country leading up to the first BMT,
Yes.
which was what to me felt like the literal targeting of Black people.
Yes. 100%.
For violence and destruction on some level.
Right.
Yeah. And so going there, like, I almost wondered, and both my parents had passed away at that point, but I remember thinking, I wonder if this is what it was like when they went to like a civil rights march back in the 60s. Like, was this that moment where you really felt how important it was for us to support each other?
Right. That's good. That's good.
You know, to just be in community with each other, because there were things that we share across the board, therapy professionals. Black massage therapists, there are only some things that we can talk about with each other.
100%.
And so that first conference was that moment where I was like, this is amazing. And it's such a cliche, but I remember feeling like I can breathe now.
Oh,
like,
that's good.
Like, I can have this moment of joy representing my community, right? Knowing that whenever I walk in a room, particularly as a leader in this profession, as an educator and administrator, I am sometimes the only one at the table.
Yes.
Or one of very few.
Right.
Right. And you and I just had that experience. Yes. Right. And at some point, you know, you say to yourself, this is what I need to do.
Right.
As a person of color, but it gets boring and it gets really frustrating, because I know there are so many talented people in our community who aren't getting the opportunities.
Exactly.
To go to school, to become healthcare professionals, and to determine the life that they want to lead. So if we go to year 2 BMT, I don't know, I walked into that first room at the keynote and I was like, oh, you did it. You did it. We're here. It was amazing. It was like the energy that we created in 2023 exploded in 2024. And just, again, the amount of support was amazing.
It was good.
I love the fact that you brought in like all the, what I call the high-end sponsors and vendors, like, you know, the professional organizations and things like that. But we also saw the small business owners who are doing great things. And I remember I bought some massage equipment from the lady with the pillows. I bought some scrubs from the angel girl. Like, I was in, and then I met your accountant. And I worked with her and I referred her to like several other people who are now like, thank you. I have a female accountant professional who believes in me and who wants to support me in having a successful business. And it just felt so good, right? To have that place. And then Benny Vaughn, come on. Like, for him to bring us into that space. And I remember being so proud, but also so overwhelmed, because I was sitting here listening to someone who had literally understood what it was like to have a family member lynched. And I thought, like, oh my God, we're still
that close. We're still that close to it. As much as people
to that awful part of our history. But then, you know, here's Benny working with Olympic athletes, and, you know, in 2023, where was he? He was calling in from some other place on the other side of the earth. Where he was from. Where were you?
Like, I can't even pronounce it.
But
exactly.
It's a lot of Z's.
I think it's
somewhere.
Slovenia. Maybe it was Slovenia. Maybe. I don't know.
Maybe it was Slovenia. I thought.
Yes.
But I thought, you know, it's still, unfortunately, that close. And so what we are achieving and what you have achieved in the BMT is so significant. And I was so also blessed in 2024. I felt like I saw a lot of the old heads. But in 2024, I was like, okay, the young people have shown up. They are here now. They are with us.
Yes.
And praying and praying that that is the next generation who takes that movement forward, because they need it.
Amen.
They absolutely need it.
Yes.
They absolutely need it.
And it's so funny when you said the whole heads, because I just did a survey, and with the survey, basically seeing how many attendees we have and how many people want to come. And with the survey, though, I also added which generation are you in, right? Because the last couple of conferences I've attended has been talking about the different generations and how we think differently, how we operate differently. And going back to business, right? Who's your target market? How can I market appropriately to the right generation, or how to, right? And so we have a lot of Gen Xers. We have millennials, and coming up the rear is the Gen Z, and then coming phasing out is the baby boomers. So yeah, so Gen
But
X.
it's interesting.
We Gen X, and then the millennials were like kind of neck and neck.
Yeah. But it's like, it's probably one of the few times we're actually going to see 4 unique generation
that's
types.
Good, right?
Right? Because the baby boomers are on their way out, but they're still there.
Present. Yes.
Right. Yeah, really. And then, you know, the fact that I'm sure like the average age in massage school is maybe 26, 27. I was 23. Everybody in my class was over 40. And so that's a tremendous shift in who's becoming massage therapists that really has only taken 20 years to happen. And so it's really kind of unique that we're in this professional cohort with so many different people. And I really hope that just expands some of the synergy, and that we don't get trapped into the ageism and the dividing by like, well, I've been doing this since God was young, so don't talk to me because you just graduated school, which is funny, but it's also something that is going to diminish us, right? It's going to diminish us. And we even see that. I mean, it's like, you know, we go into some of these places, and you and I have done a lot of things, but there are certain people that still talk to us and like, you haven't done everything. I've written a book. You haven't written a book. And I'm like, wait a minute.
That part.
Wait a minute.
You preaching now, Ericka. Like, I can if I wanted to, but I have other things I have going on. Right?
Exactly.
But it's true. But going back to oncology, so seeing Ericka and talking to her, I found out one of my closest friends from high school was diagnosed with cancer. And being she's in New York, and coming from New York, I was like, you have to see Ericka. So I immediately text Ericka, right? And I immediately did a introduction, and she took care of my friend, and that meant so much. And this is what the conference is about, right? It's just networking and feeling secure in the person who you're referring to that you can trust, that's going to take care of whether it's a friend or a family member, if you're not in the same, or even a client, right? If your client is moving to a different state and you meet somebody in that city or state, hey, this is my, can you take care of this person? And so that really meant so much to me, because I couldn't be there, right? I couldn't be there to support her in that way. And so for me, it was like Ericka was the extension of me that just did my heart well. Yeah.
Well, I appreciate it so much that you trusted me. And it was interesting feeling that connection, working with your friend and knowing that I could support her, and that we all three kind of shared this really interesting space and connection. And, I think I also allowed her to understand a lot about what was going on as she was going through treatment and the support that she was going to need. Right. And I think that's also why I was so happy that you selected my application to teach oncology massage. Yeah. Because, when I think about Black massage therapists, I'm also really thinking about what I've gone through. And again, the reality that we kind of always have to be ahead of the game and ready to reinvent at any moment,
Right.
just because. And oncology, unfortunately, is a specialty that will serve so many massage therapists
Yes.
if they choose to embark on training. Because I mean, it's crazy, but what the American Cancer Society said, in the next 10 years in the United States, 1 out of every 3 people is going to have their life impacted somehow by cancer.
Yeah.
And it doesn't mean that you may have cancer, but it's going to be in your family, your friend group, somebody you know, right? And so with almost 400 million people in this country, that's a lot of people being diagnosed and needing care. And massage is wonderfully safe and effective for treating all the negative side effects that come with cancer treatment.
Amen.
And if it's going to be 1 out of 3, when you think about who your clients are, just do the math.
Right.
That's like 30% of them are going to have somebody in their life or have a cancer diagnosis themselves. And if you don't know how to treat them, that is business you are turning away.
Right.
And how much more lucrative financially, but also emotionally and spiritually can your work and your business be when you can engage as many people as possible?
Right.
When you can wrap your arms around a bigger community and offer services to people who are being devastated by a really scary and challenging disease.
Yes.
And medicine is getting better, research is getting better. So most people are living through their diagnosis and treatment, but afterwards they need specialized care from a massage therapist. And so I wanted to help our community understand that this is work that some of us really should be doing.
Yeah.
It can also be the work that helps you age in the profession, right?
Because it's light work.
It's tired of doing deep tissue work.
Exactly.
When you're tired of doing deep tissue work, oncology gives you another specialty that can allow you to kind of age in your work. It also opens the door to other things like lymphatic drainage, which both you and I do.
Right.
And that I've taken on just because that's the work that's going to take me into my 80s as a massage therapist, 100%. If I choose to keep working at that age. But if I do, I'm going to be doing lymphatic drainage.
Yes, it's very light and it's one and the same. So, for me, Ericka going in specializing in oncology, I had a contract with a cancer treatment center here in Arizona and specializing in lymphatic. So we were doing lymphatic work on these cancer patients, and there was other therapists who would do oncology. So it's like it works together, and it's for the benefit of the patient at the end of the day, and it makes them feel good, especially when they had chemo on a Monday and you see them on a Wednesday or a Thursday to help flush their system out, right? Because chemo is no respecter of persons. So it's attacking the good white blood cells, right? And so we want to prevent that, right? And help lower it as much as possible by promoting healthy treatment.
Yeah, and helping people tolerate treatment is a big part of how massage becomes a helpful intervention. Right. I just taught a class this past weekend, and I was saying to my students, so think that this person has just only been touched in medical ways, looking for cancer, poking and prodding. Doctors are amazing, but they're not the best palpators in the world.
Right.
And now you are helping them reconnect to their body and making touch feel good, letting them feel okay about accepting and receiving touch. And that becomes a big part of their healing process. And, look, the research shows all the things that cancer does. Chemotherapy causes neuropathy. It causes issues with sleep. It can lead to depression, fatigue, pain, all of these things massage can help with. So it's like, we can't change the fact that you've been diagnosed with cancer, but we can make the process of treatment and your life beyond that so much better by introducing appropriate therapeutic touch. And again, the more of us that know how to work with a cancer population, the better off we are going to be as a world and a society. And one thing that I am going to include in my class is an honest discussion about the disparities in cancer diagnosis and cancer care for people of color. And that is another place where we as massage therapists can intervene and support in the best way possible.
Yeah.
Because unfortunately, African Americans more than not get diagnosed later in terms of cancer stages. So oftentimes they are dealing with cancer at a more serious point when an earlier intervention could have been curative. And now we are just trying to save a life as much as possible. And unfortunately, in cases, particularly things like breast cancer, when Black women get breast cancer, they tend to get the breast cancers that are harder to treat.
Right.
And so it's like, we need to understand and own some of that for our community, but we also need to understand how we can support people to live their best lives and manage what's going on in the best way possible, whether we're working with them while they have infusion, after, 10 years later,
Right.
you know, at end of life. It's all really important. And oncology training is kind of the beginning. I always say to my students, once you've been trained as an oncology massage therapist, you are now the MacGyver of massage, right?
Because you're always trying to figure things out, right?
Yeah, and people are going to come to you with all the stuff: neurodegenerative disease, spinal cord injury. Oh, but you trained in cancer, you can handle this. Yeah. It opens the doors for lots of opportunity and for you to help more people.
I love that. Yes,
yeah.
I love that. So just to close out on this wonderful conversation, I always like to ask, is there any resources that you would suggest for our listeners in regards to cancer or massage or anything like that they can start looking up?
Well, one book that I bought, and I bought it after Benny Vaughn mentioned it in his keynote, was Touching by Ashley Montague. It's a great book. And it's really, particularly if you're a science nerd, which I am.
Right.
It's the science of skin and kind of some of the subtle things that we learned in massage school, but then you layer on so many other things you kind of forgot how important it was to remember the largest organ in the body is what we touch and how much is transmitted through that. And she does this great storytelling through experiences of different people.
Okay.
And she talks about elderly people's approach to touch and how they feel when people stop touching them and some of the cultural aspects of touch. And even how she does this great chapter about how males are misperceived because of our belief in how they receive touch. And it's just kind of like, it's, you know, she's saying things that are not earth shattering, but with such a focus and clarity that I remember picking up this book and being just like, I have to read every single page.
Okay. And
I actually gave it to some of my students to read.
Okay.
I have a group of folks who work with hospital-based patients. And I was like, you guys read this book about people who are aging, end of life in hospital, and how they feel about touch, not how we feel about touching them. Understand how they feel.
Their mentality.
Exactly. And so I think that's a great resource, her book. And I'm really excited because I'm about to go to the International Massage Therapy Research Convention
in
weekend. Next week.
Okay.
Next weekend. I'm going there and I'm gonna hopefully hear a lot about some new resources, especially on the research end, because I think research is like this weird term for massage therapists.
Right.
Like, we want to know it, but we're not really sure if we should do it, and it doesn't really fit us. And I'm like, okay, everybody stand down. Right. But I think there's so much that we can learn.
Right.
And there's also so much that medicine can understand about the power that we have.
Yes.
If we have more research in massage, even if it's stuff that's just very, how do I put it, but standard research, but really research that gives us validity, but also gives us ways that we work differently. So I'm really excited to go there. So if I find any good resources, I will let you know so you can post them on your website. And because I know you're just a resource of information for people, which I appreciate.
We try to be, or underneath this podcast too, as an information resource by the time we roll this out. But I would like to thank you so much, Ericka, for this wonderful conversation. Thank you so much for being part of the third annual BMT conference, actually being an instructor this time and not just an attendee. So I'm excited about that. And yeah, I look forward to seeing you again soon. And everyone, thank you so much for watching. And is there any place that you want them to subscribe or look you up? I know you would Heal Well.
Well, they can look me up on Facebook or Instagram. Also, one of the organizations that I work for is Heal Well. They're a great organization. They provide continuing education to massage therapists. Our motto is touch, teach, advocate. So if any of those things feel interesting to people, check us out. We do a lot of things that other people don't do. We say a lot of things that other people won't say, just like Davonna. And so they're a great organization to work for and be a part of. And we love sponsoring the Black Massage Therapist Conference, which we will be doing this year as well, besides having me there to speak. So looking forward to that.
Yes, they're going to have some swag in our bag. So check them out. And we're so excited. We're so excited to always partner with Heal Well. So I appreciate you. Thank you so much again. And for all those, remember to like, share, and subscribe. And we'll see you next time. Bye. Hello, please like, share, and subscribe. And don't forget, check out our next podcast episode. See you later. Bye.